So, Tina and Steph, one of the things I was looking at in some of our data in a particular agency, I saw that over 30% of their OASIS changes came from item M1850. Tell me what you're seeing when this item comes across.
Well, I see this question answered incorrectly a lot. This is probably one of the items that we change the most frequently. Really, what clinicians need to consider is the patient receiving any help from another person? If they're receiving any help, help includes verbal cueing to get out of the chair. It includes a little bit of hands-on assistance. It includes a lot of assistance. But the important thing with this item is it also has to include the patient using an assistive device in conjunction with that human assistance. So there has to be both components in order to change this item from number 1 to number 2. I frequently see this recorded as number 1. What do you see, Tina? Do you see a lot of ones as well?
Yeah, I do, when really they should be able to score 2 because that patient's requiring assistance and like a walker or a cane. So a lot of times I'll see that the patient is requiring assisted device and assistance from the caregiver, and they're not including that to select response 2. The other thing I'm seeing is the bed fast and chair fast. They'll capture that incorrectly.
A lot of times they'll call a patient bed fast and chair fast. So
Yeah.
this one might say bed fast, but then you look at M1860 for ambulation and you notice the patient's actually chair fast. So
Yeah.
that's where the inconsistencies come into the OASIS that really have to be corrected.
I see that too. And then they'll also capture the Z code incorrectly, right? Like they may say Z99.3 when really it should be Z7401.
Right.
So when responding to this, when you're responding to M1850, you need to keep M1860 in mind as well, because they really go hand in hand.
Right. And I think what's so confusing for this item is CMS words it as number 2, able to bear weight and pivot during the transfer process, but unable to transfer self. That gets a lot of clinicians because they're afraid to say that the patient can't transfer themselves. And they're really afraid to say that, especially if they live alone or they don't have anyone that can really help them. And the important thing to remember is that it doesn't really matter the circumstances in the home. You're simply gauging their ability to do this, to transfer safely, effectively, and
Yeah.
efficiently.
The 2 biggest things to remember there is ability and safety. I think that trips up a lot of the clinicians when answering this as well.
Safety is the primary concern, and then a lot of clinicians will more or less see what the patient's doing, but they're not considering that if the patient's doing it,
And it's
they
not
might
safe.
not be safe. That's the whole reason we bring home health into the home is to make the patient safe at home so they can stay at home longer.
A lot of clinicians will respond 0. And you got to think about it this way. If it's all zeros, does this patient really need home health? If there's zeros, right, why are we out there? So that's something to consider. If you're seeing that a whole lot, you need to take a second look. If they're having falls or pain or different things like that, that's going to affect this item and, will allow you to move up to maybe a 1 or a 2.
And also think about physical therapy here.
Think about physical therapy. Go look at their assessment, right? Are they saying that the patient needs assistance, caregiver assistance, standby, verbal cueing? You're really going to want to use the therapy assistant when responding to this M item.
If you're the start of care clinician and you're the nurse, you're considering putting in physical therapy or occupational therapy. You can't really refer therapy if you're scoring the patient with zeros. You need to show the need for physical therapy or for occupational therapy. And one of the best ways to support that referral is through the M items, through this item especially.
Yeah, so when responding to this one, you really need to dive into those therapy assessments and see the reason that they're out there.
Thank you for joining us for this episode of Coding Corner, brought to you by HealthRev Partners. Grow your agency and expand your mission with a high-power revenue cycle management partner, powered by Velocity. the most advanced coding and billing software in the market for transparency, analytics, and clinical intelligence.